I don't know which one of you gave me the warning, but one of you did. I think that it was probably you, Joy. When I was coming up on my very last treatment. And you gave me a warning that everybody thinks, oh, we're going to bring in balloons and everyone's going to come and it's going to be the best thing. We're going to go out and do this big party. And she said, and you may not experience it that way. You may experience it as a very emotional, and it may be difficult for you. And boy, was it. And
It's
I don't
almost
even
a
know if I can
separation
explain
anxiety because you've been to a physician or seen your nurse or a nurse at least once a week for how many months that you've went through this. So, you know, whether it's your doctor, your nurse, your, you know, radiation therapy people, whoever, you are connected to those medical people all the time. And I think that when you finish your treatment and we say to you, okay, come back in a few months and we'll check you out, you're kind of like,
It's scary.
Well, wait a minute. I've been coming here every week for 6 months or 4 months or whatever. And now I have to walk away and just, you know, it's a very scary thing and you don't feel as proactive anymore.
Yeah, that's separation anxiety. They can tell you about it, but boy, you really
And you're not
feel
alone.
it.
Many, I will say 99% of the people, when we're handing them, you know, yay, you're finished chemo, here's your, you know, your graduation present, your card, and we're giving them their hugs, they're all crying. I mean, they're happy tears, but then they're, you know, there is just a lot of emotion on that last day.
And it's learning how to live your life again.
And like try to get back to that normal, if you know.
Because I think it changes you. I think
absolutely.
it changes how you feel about things. It changes how you look at things. And again, that's back to your family doesn't get it. They can't understand it. That's okay. But then it's left to you to figure out, how do I now go back and be normal again when I've had this experience?
It definitely makes you reevaluate life, and you look at life in a different way afterwards. And it's somewhat disconcerting. I mean, I've just been speaking to like one cancer survivor after another, and most of them say that the time after chemo, the after treatment, was their most perplexing, most emotionally difficult time. Like who would ever think that?
Well, I think you go from diagnosis, you're all of a sudden having surgery, and then chemo, and then surgery again, and then maybe more chemo, and then radiation, and it's a time of, it's a whirlwind. You know, you're going from this doctor to this doctor, and then all of a sudden the whole thing is done. Everything's done. And now we say, okay, you're done. And you kind of look back and you go, where did the last, 4, 5, 6 months go? And who am I now? You know, it's a very, it's tough.
But I do think the further out you go, the easier it gets. So,
Thank you for that one.
Your 3 month checkup. You go to your 6 month checkups. When you get to those 6 month checkups, and then now 2 years have passed. I think as time goes on, you do get closer back to your normal, and you do sort of. I mean, you'll never put it behind you, but you stop sitting and maybe obsessing and worrying so much, and you get back to your life.
And how nice is it when that person walks in the door 5 years later and says,
Absolutely.
Nancy, I just had to come and say hi to you.
And
so it's a great.
I'll be there 5 years
It's
from
a
now.
great.
Absolutely.
And most of our patients do, when they come for their 3 months or 6 months a year, they always, make a point to stop in and say hi, and we love that.
We have a lady that we treated 15 years ago now, probably. And she, to this day, brings us a Christmas ornament every Christmas, Nancy and I. Every year.
She does.
And
Yes.
it's just, it's amazing, because it's, even though this time has passed and she's now in a different place in her life, and, whatever's gone on in her life, she always comes back and says, I won't forget that, because whatever, and it might have just been, I held her hand one day, or Nancy gave her a tissue because she was upset, or, and I think that, again, I think we started by me saying that, that I did my job. I did my job
And let's just all remember, all you survivors out there, to go back to these wonderful unsung heroes who help us, who get us at our most vulnerable time, and who invite us to dump everything on them emotionally, and are there for that tissue when we cry and for that hug, because you guys are big huggers, and I love
Yes,
that.
we are.
We
We
are.
are. You
We
can't
are
leave
big
treatment
huggers.
without a hug.
No.
That's what we always tell people.
Well, that's good. It's just as important
It is.
as the infusion itself, because it keeps us feeling okay about life.